Fantastic. So I can get us started. Good afternoon. Officially, good afternoon, everybody. My name is Marcela Betancourt. I'm the Executive Director of the Latino Policy Institute. And I just wanted to say thank you to all of you who made some time to be here at this moment. I also wanted to say thank you to DHS, EPI, and all of their partners. The Latino Policy Institute is part of the Immigrant Coalition of Rhode Island. We are very proud to be part of this organization, especially with a lot of the work that is happening at the moment. A big part of why we wanted it to support this, this meeting and these efforts that hopefully it's not just one day, but ongoing, is due to the many changes and impacts that the many impacts that some of these changes will have on our communities, not just our immigrant communities, but Rhode Island as a whole. So I just wanted to say thank you once again. And we hope to continue a lot of these conversations and more importantly, the feedback and support that we can provide to our government partners in the next few months as we better inform our community. Thank you. And I will give it to Kim and or David.
Hello, folks. My name is Divya. I'm just going to replace the spotlight with me. I'm Divya Nair, a Senior Policy Analyst with the Economic Progress Institute. The Economic Progress Institute is a research and advocacy organization based in Rhode Island. We do research and advocacy around economic and racial justice issues. So I am going to be doing a super quick slideshow presentation around the so-called Big Beautiful Bill Act and the changes it makes to immigrant eligibility. But I also wanted to share a quick rundown of what the time here is going to look like. So I'm going to have my presentation, and then Kim Rausch, who's the Associate Director at DHS, is going to have a few quick updates, and then we're going to go directly into a Q&A portion based off of the folks who registered and the questions that they had, and then that's going to be 45 minutes, and then we're going to have some opportunity for the folks here to ask questions, and I request that you do so in the chat, and that'll be uplifted to us, and we'll make sure that we're ready for that. So give me a moment while I try to share my screen. All right. Should work. Can folks see this?
Yes.
Okay, perfect. I'm going to present mode. Gonna take a minute. All right. So we are here to discuss the federal reconciliation changes to immigrant eligibility for public benefits in Rhode Island. And so there's a few words going around that I want to clarify. Federal reconciliation, One Big Beautiful Bill Act, OBBBA, HR 1, these all mean the same exact thing. And this bill was enacted on July 4th, 2025. Here are some of the programs that it directly impacts: Medicaid, CHIP, Medicare, the Affordable Care Act, marketplaces, SNAP, which is the Supplemental Nutrition Assistance Program, also known as food stamps. The context for these changes is that they all have slightly staggered start dates. And the impact will be that it changes eligibility rules and reduces federal funding for all of these programs, right? And it particularly impacts immigrants, especially particularly those who are lawfully present. So I'm going into the next slide. So what are the changes to Medicaid, also known as Right Care and CHIP? People who are still currently eligible are lawful permanent residents, green card holders, Cuban, Haitian entrants with a range of current and past statutes, and people from Micronesia, Palau, or the Marshall Islands living in the United States. So that phrase, the people from Micronesia, so that is folks under the COFA, which is the Compact of Free Association. So some folks who work in immigration might know them better under that term. But one thing I do want to uplift is that Rhode Island will continue to have Medicaid for all children up to age 19 and pregnant and postpartum people. will still have access to Medicaid regardless of their immigration status. So for the children, that is because of the Cover All Kids Act that passed in 2022 in Rhode Island. So that enshrines in the state as of now that all children up to age 19 will have access to Medicaid regardless of their immigration status. People who will no longer be eligible for Right Share beginning October 1st, 2026 are refugees, humanitarian parolees, asylum grantees, certain abused spouses and children, people who come here under that status, immigrate to the United States under that status, and other non-citizens. Medicaid will also have work requirement, like more stringent work requirements beginning January 1st, 2027. It will require a few additional things, as well as reporting for people within the income brackets of 100 to 138% of the federal poverty level. Some states may opt in to this earlier with a few temporary exceptions possible. Moving on to Medicare. Oh, and just for context, if anyone's writing this down super quickly, we will be sharing these slides. So don't feel like you need to record everything that's said here. We'll be sharing them out as well. Medicare and Health Source Rhode Island. This is very similar with the people who are still eligible for Medicare being lawful permanent residents, green card holders, Cuban, Haitian entrants, and people from Micronesia, Palau, or the Marshall Islands living in the United States. Folks who will no longer be eligible starting January 4th, 2027 will be refugees, humanitarian parolees, asylum grantees, and certain abused spouses and children, and other non-citizens. One additional thing around healthcare is changes to Health Source RI beginning January 1st of 2026. People who are lawfully present immigrants with incomes up to 100% of the federal poverty level will no longer be eligible for the premium tax credits to help buy coverage through the marketplace, which is a Health Source RI. Changes to SNAP. So the changes are broad. They're reduced eligibility for non-citizens similar to Medicaid and Medicare, as well as expanded work requirements. Folks who are still eligible is the same category of lawful permanent residents or green card holders, Cuban, Haitian entrants, as well as people from Micronesia, Palau, or the Marshall Islands living in the US. And then folks who are not eligible, and here's where we don't have a beginning, is because the DHS, as of what I know, is they're still waiting for federal guidance on that. And so that will kind of dictate when the implementation timeline for that is. So those who will no longer be eligible are refugees, humanitarian parolees, asylum grantees, certain abused spouses and children, folks who immigrated here under that status, and other non-citizens. With the caveat that federal guidance is still pending, and so DHS is waiting for that guidance in order to be making changes. You'll see potentially in other states that some changes have begun as early as 2025, with others to be phased in later. And then this has been the big question that we've been getting from people who've registered, is the question around data privacy. So what I can tell you now, and I'm sure DHS will add more to this later, is the federal government is requiring states to turn in personal identifying information for all SNAP and Medicaid recipients. However, Rhode Island is currently, as of what I know right now, not provided any of the requested information to the federal government. This is due to lawsuits that Rhode Island has joined challenging this request, with the outcome of these lawsuits still pending. Here's some of our recommendations. I'm sure DHS will have some as well, is what you can expect. Expect more paperwork forthcoming, especially for these people under the no longer eligible criteria. And so make sure to respond quickly to avoid gaps. Check your mail, open your mail, and make sure that the state of Rhode Island and DHS has your most accurate mailing address. This is one of the big ones. And some folks may lose eligibility for a broad range of benefits and services. And so make sure that assist them with state-funded or local programs. This is where the folks who are here, who are direct service providers, have that capacity, I believe. And then for SNAP is confirming the eligibility status, as well as new work rules, and then connecting folks to services where they are continue to be eligible, such as the food banks. And the big takeaway being keep documentation current as much as you can. The appeal and fair hearing rights still apply, so please feel free to appeal and get a fair hearing to your benefits if you feel like you've unjustly been denied or removed. That's my presentation. Please stay connected with the Economic Progress Institute. We had over 220 people registered for this training. So we're here as a resource for you all to provide the most updated information that we can. Please visit our website, sign up for our newsletter. I believe this QR code will take you to our link tree where you can get acquainted with us if you're not already. And a lot of this information is constantly changing, and I do my best at EPI and our team to update the Guide to Government Assistance. This is our resource on all of the programs that people are eligible for. We're doing our best to keep it updated with all of the changes that have been happening. That is my presentation, and so I will now turn it over to Kim Rausch to give a short update from DHS.
Hi, all. So I just want to say first and foremost how important all of this information is to the entire Rhode Island community, and also how frustrating it's going to be to hear that we're still waiting for further guidance from the federal government. So there's enough off of what was in the Reconciliation Act, it's what we call it here at DHS. It's the same thing that we just went through. It's really important to acknowledge the fact that that was signed back in July. Typically, we have quite a bit of information from our federal partners at this point. However, for whatever reason, the federal government has not given us, codified written guidance. So we can take from the words of the reconciliation bill what we anticipate the changes to be. And that's what we've been doing. We're running our data, our numbers. We're trying to understand what the effect not only on the community, but economically, and how this is going to really reshape some of our social safety net programs across the state of Rhode Island. So everything that we're going to go through today is based off of, the black and white text of the reconciliation bill and some of the assumptions that DHS is currently working off of due to the fact that there hasn't been a formal federal guidance. We really want to hear from the community and understand, especially if there are gaps that we have not yet identified, and make sure that the resources and the information is flowing to the best of our ability. So that's really one of the main goals for me to be here today. And I just appreciate this opportunity to be able to discuss where we are and the situation we're in. There are several different meetings happening right now across the state. There's a federal compliance meeting that the Executive Office of Health and Human Services has been running, very much like we did to return to normal operations or state covered Rhode Island. You're going to see new websites coming out about the Reconciliation Act and ways that people can stay covered, which has already been identified. Make sure that DHS has the most up-to-date mailing address, cell phone number, or phone number to get in touch with people, so that if and when we have to request additional information, it goes to the correct place, and that our participants and our Rhode Islanders have the most amount of time to respond to that, so that if possible, we can maintain eligibility. If not, we can provide resources whenever possible to the community at large. So with that, I think we'll kick it over to have some of our Q&A.
I'm just going to spotlight the folks who are, okay, here it is. So Juan Pablo, you're the only one who hasn't introduced themselves, so I'm going to give you a minute to say who you are right now.
Thank you so much. I'm Juan Pablo Campo. I am the coordinator for the Immigrant Coalition of Rhode Island, which both EPI and the Latino Progress Institute are part of our members. Together, we're all 36 organizations.
All right. So getting started, this was obviously a question answered in the slideshow, but always good to have the state answer it on a public forum. What statuses will still have access to DHS benefits? So this includes a broad variety of benefits, not just the ones mentioned here.
Yeah, so the way that we're looking at the reconciliation bill and what's sitting in front of us right now, and based off of the different programs that DHS administers, there's really two different pots of federal statutes that we have our eyes on. We have our eyes on the very specific changes that came in through the Reconciliation Act, which we went through in this, and I'll give you a little bit more. And then we have PREWOA, which is a pre-existing long-term law that's been around that limits some of the access to our social service programs. That really sits more within the Administration for Children and Families. So that's our child care program, that's our Rhode Island Works program. And in those programs, what they have always limited us to is that it is typically our adults have to be our legal permanent residents with 5 years or 40 months. 40 quarters of work. That's our legal permanent resident. Children don't have the 5 year bar for most of those programs. The children don't have need to have the legal permanent resident status. But once they turn 18, they do have to have the 5 year bar. So that's our legal permanent residents. U.S. citizen children maintain services even if their parents do not, depending on what their parents' immigration status is. In our current environment, humanitarian parolees who are from Cuba or Haiti, as well as the specific islands under COFA, are still remaining and still being able to access our safety net programs pretty much across the board. And then where things are going to start to deviate is that there's going to be a portion that's still underneath those pre-WOA rules and then a portion underneath the new Reconciliation Act. So SNAP and Medicaid are being taken out and they're being restricted further. So they're going to remove services to our asylees, parolees, non-humanitarian parolees. It's going to remove access to our refugee populations. And again, in the SNAP world, the federal government has all different times and place for this, for SNAP and for medical. It's in my opinion, intended to be confusing. So it's going to be hard to identify when things come on and when things come off. Our anticipation is that this could happen as soon as November 1 for the immigration requirements for SNAP, but it would be a different timeline for the immigration requirements for Medicaid. And that's some of the things that we're waiting to hear back from our federal partners on what this is going to be. The other piece that's really confusing here is that humanitarian parolees that are not from the COFA region or from Haiti or Cuba are very likely going to remove their access to these services, but humanitarian parolees from those two regions can maintain it, which is very hard to message and explain to the public why one region and why not the other. So when we're looking at the grouping, and I hate to do this in the social service net, we're going to talk a lot about what program specifically we're talking about. Are we in those pre-WOA rule sets? Are we in this new reconciliation rule set? So those are the first questions that we have. And then the second thing that DHS is likely going to ask, because it's getting so specific that humanitarian parolee piece is very clear here, we're going to be asking for USCIS documentation sometimes because we really do need to know once a person declared themselves to the United States, what does that say? And that's important here because our temporary protected status, our TPS status, worked for a long time to at least get people into our system and to start doing that analysis on whether they are eligible or not. What the Reconciliation Act has done is it has stripped away some of our ability to presume eligibility because before the net was so much wider, it was easier to identify. Now, with the populations being narrowed specifically for our two largest programs, SNAP and medical, it's important for us to make sure that we have the correct eligibility determination, and that is going to be DHS asking for things like USCIS documentation. We have some federal interfaces that we can jump into and try to identify whether somebody has eligibility status. But really the best thing that we can do to evaluate whether somebody's eligible for our safety net program is those USCIS documents.
Thank you so much for that explanation. Can you share how mixed status families are affected by eligibility rules for programs like SNAP and Medicaid?
Yeah. So when we have a mixed status household, we're under the assumption that the federal government is going to maintain what they've always allowed, which is that U.S. citizen children or children that are legal permanent residents are going to be able to access these safety net programs. And that's imperative for Rhode Island to make sure that we have a safety net for our children. But what gets complicated is that as the family has different immigration statuses, the way that we count that family member towards benefits or not towards benefits, but also whether we count their income or don't count their income, all depends on these two pools of the immigration law that we're largely under. So it's easiest to explain this by some examples. So I'll do that. So in the SNAP and medical world today, if the adult family members are, I have two U.S. citizen children, I have a U.S. citizen LPR, and then I have two parents. One does not have any status, does not fall within a humanitarian parolee or a status, an LPR. They're marked no status. And then another parent is an LPR, let's say, plus 5 years. What happens right now is that we have a household of 5 individuals because we have the 3 kiddos and we have the 2 adults. And what ends up happening with that household is that since I have two U.S. citizen children and I have an LPR child, they're all eligible. I have a parent with no status who's not eligible for services, and I have another parent that has an LPR plus 5 years that is eligible for services. So what ends up happening is that the benefits provided to that household is a household of 4. So in the SNAP world, they're going to be eligible for benefits for 4 individuals. What's really important to keep in mind is that as some statuses are going to come out of eligibility for SNAP, if let's say that other parent wasn't an LPR but was an asylee, they are going to be taken out of the benefits. So now the household's only going to receive SNAP for the 3 individuals, and the amount of money provided is based off of the eligible individuals from that household. So the household of 3. However, any of the income brought into that household from the 2 parents is counted. And that's why it's really important here to make sure that we have the correct status. So even though an adult member is removed from eligibility from SNAP, it doesn't mean that their income is removed from eligibility of SNAP. And that's really important because that income counts against the amount of money that they can receive on their EBT card for SNAP. So the way that this equation goes is as the federal government and the Reconciliation Act is constricting these populations, our asylees, our refugees, portions of our humanitarian parolees, we're also notifying you all that those people will be not eligible for SNAP, but if they have income, that still counts against their household. So it's not as though you take the individual out and you don't count their income. You still count their income. So it will have an effect on families, whether or not they receive, if they're receiving $384 a month right now because it's 4 individuals, you remove an individual, it's going to drop down to $326. But that because that individual's funds are still counted in the household, it could actually drop down to $288. So those are the things that the household composition, that's how we explain who's in the household, who's not in the household, and whose money counts towards the household, are going to be drastically altered by that reconciliation bill. Because if there was income in that household and it's been declared to DHS, that income can shrink the SNAP benefits and shrink the benefits further based off of how much income is in that household. So it's not just who's in the household to receive the benefits, but how we count the income to the household. That's also really important here. And on the Medicaid side of the house, it's similar. Obviously, the Medicaid benefit, for the most part, is not going to be how much Medicaid you get based off of household members. But if the working members of the household's income is going to still be counted in that household, they might no longer be a Medicaid recipient. They might be a qualified health plan recipient, right? They might need to go to health source based off of their income levels. So that household composition, how we look at our families, who counts in and whose income counts into that household, is really important. And so for our working families and families that are doing exactly what we told them to do when they came to this country, come to the United States, declare yourself, get your work papers, contribute to your household. If they are in a status that's being restricted, they are also going to be in a status that their income will count count towards that household. So this kind of feels like a double whammy to our families. Not only are they going to lose potentially that adult member, we're still going to count that income towards the household. So that is how it works in the reconciliation bill and how it works in pre-WOA. It's just the pre-WOA laws haven't been changed yet. They were only able to attack the changes in SNAP and medical through the reconciliation bill. They haven't gone through formal changes to the pre-WOA law themselves. And that was complicated, I know. I tried to break it down as easy as I could.
Okay, and this is like the next question that people have had. And then Rachel Flum has kind of added another layer to it in the chat, so I'll add that as well. How can community members check if they or someone they know will lose coverage based on their individual immigration status? Will DHS be starting to notify people directly about coverage loss? And then Rachel's question here, if you don't mind answering, is will you be cutting immigrants off at recertification only?
Yeah, so we're very hopeful that FNS is going to allow us to take people through the recertification period. So the only guidance we've received so far from the federal government on the reconciliation bill is about our standard utility allowance, which is a different way to be able to provide more benefits, more SNAP to households. So we're hopeful that since in the standard utility allowance, they gave us the opportunity to go to the recertification date, we're very hopeful they're going to give us that opportunity under the immigration section of the Reconciliation Act, but without guidance from FNS, I can't definitively state that. What is known is that the Reconciliation Act that was signed on July 4th technically took action on July 4th. This was one of those areas in SNAP. Many of the areas were upon enactment. There wasn't a date to say this starts at a later date in time. So we would need FNS to give us that guidance to allow us to move to the recertification date. Otherwise, it would be pretty much as soon as they tell us that we have a time frame once they give us guidance. With that being said, we have a responsibility to make sure that we're communicating with the recipients of SNAP as quickly as we possibly can. So the initial question is, how do I know whether or not I'm going to be able to receive from DHS or not? So the very first thing to be identifying is in the USCIS paperwork or in paperwork in general from DHS. A great tool here is if they have a recertification package. So if you've been receiving DHS services for a while, you likely have received one of those big old packets from us. What's great about the recertification packet is that it's pre-filled out. So there are sections of that according to DHS, that is what we have you categorized. So if you look to your household members, so again, that same grouping, we have 5 household members. If in that 5 household members, you see that the adult member is listed as a humanitarian parolee, you are likely going to be somebody we're going to say, can you please give us some more information? We want to know if you're a humanitarian parolee from Cuba, Haiti, or our COFA region. We want to make sure that we have that information correct. If you're not a humanitarian parolee from those areas, we will notify you that your SNAP for that individual is likely not to continue. So what will happen is as we're going through and receiving the information from the federal government, we are going to try to get notices out to a distinct population. We do not want to go out and scare thousands of Rhode Islanders. Our goal is to do this as succinct as possible and say there's a possibility underneath the new rules you may not be eligible for SNAP anymore. Please make sure you provide DHS this type of documentation and we'll list what we think is going to be the best thing. Please get this to us before X date, and the dates are all dependent on what the federal government tells us. And that as that information comes in, we'll be updating our system so that it correctly reflects. So if you are a humanitarian parolee from Cuba, that we will have that properly reflected. If we have you listed as a humanitarian parolee and then it comes in that you're a humanitarian parolee, but let's say you came in during the Afghan time where we were allowing humanitarian parolees from Afghanistan to come in, you're Afghani, you will likely receive the paperwork that, the individuals in your household that have status that can continue will remain on. However, you do not have status that will allow you to remain. So what we typically try to do is get notification out to a family at least 30 days in advance. at minimum to say, please give us as much paperwork or give us the information as possible. And then right around 10 days prior to the end of the month or 10 days prior to a DHS having to take action on your case, which means make a decision on your case for eligibility, an additional letter will go out that will say you remain eligible, and this is a decreased amount. You are no longer eligible and you are terminated. And that is called our benefit decision notice. We refer to it as a BDN. The last pages of that BDN have your appeal rights attached to it. So if you feel that this has been done incorrectly, you can always appeal that information to DHS. And again, it can be different for different household members. So you want to make sure that when you get that BDN, the benefit decision notice, the front page is going to say you're losing, you're gaining, your benefits are going up, your benefits are going down. It can sometimes be confusing because for the household members that are on SNAP and remaining on SNAP, it might say that their benefits are going up, and then you flip to page 2, but it will say the adult member has lost their benefits. So you have to read the pages 2 and 3. You can't just always rely on the page 1 of the benefit decision notice. If you think that has been done incorrectly, you should fill out the appeal paperwork and you should get that into DHS within 10 days, because that's really important to make sure that we're holding that information there. I think I hit all those. If I missed one, I'm happy to go back.
Okay. Thank you.
What is DHS doing to protect data on children and families who are undocumented from use by the federal government in immigration enforcement?
Yeah, this is huge. So data right now is a major concern, not just for Rhode Island, but for many, many states. And the federal government has typically allowed, we do data transfers with them on, what we call aggregate data, which means, I have 5,000 humanitarian parolees in the state of Rhode Island, right? It's a big number. It doesn't give any individual level. So most of our reporting to the federal government looks like that. There is some day-to-day reporting that happens to the federal government, specific to SNAP, also in the medical world, that has more to do with like what's happening in those SNAP worlds. So are there SNAP transactions happening? AKA, are we shopping at stores and buying food? But that isn't associated with somebody's identity or somebody's citizenship. So that's normal processing. That's how DHS and the federal government work regularly. We do have a request in from USDA FNS to give more specified data. And that data request from the federal government does include some immigration information. So Rhode Island has joined 11 other states in a lawsuit. It's based out of California, saying that we do not think that the federal government should be allowed to ask for this information, nor is it practical for DHS or any state to compile the volume of information they're asking for in such a short period of time. So what Rhode Island is trying to do is we're trying to make sure that we're following our own rules, right? Because we have our own state statutes and our own requirements of data amongst our state. We have to make sure that we're protecting the department. I can't pull together 1 million data elements in 2 days. That's not reasonable. That's not work that the department can do. But most importantly, we want to make sure that this is what's the intention behind this, because we've been giving that aggregate level data, right? Yes, we have 5,000 humanitarian parolees for years and years and years, and that hasn't been problematic. So why is this request coming in and what is this being utilized for? So that is currently under litigation. So there are various due dates in that litigation that are happening right now. I believe the next due date for litigation is a week from today, where we have to wait from the courts or wait for USDA to respond to what's happening in the courts. So what we keep doing is we keep waiting to hear on what the requirement is going to be for that data exchange. The federal government has stated that if we do not provide data, that they will fine us, and that we are still utilizing the courts wherever possible to keep Rhode Island safe, and on many different platforms. So that's the first layer, and that's the big thing that's happening right now, especially in the SNAP world. In the medical world, they're sending out requests or additional data requests. This was just talked about in a previous meeting, and different sets of data that have come in. So far, that's happened in other states for Medicaid level data. I don't believe it has happened yet in Rhode Island. And the Executive Office of Health and Human Services will deal with what that request looks like, just like we did in SNAP. We work with our Department of Administration, we work with the Attorney General's office, we even work with the governor's office to figure out whether this is something that we can comply with, because every state has different state rules about data security and rules. And then we also have to make sure that we have, if we are going to comply with something like this, how we upload that data is really important to make sure that it's safe and secure and that all the technology is in place if that is something that we have to go through with the federal government. So right now we're being very cautious. We don't want to send data just because we were asked for data. We want to make sure that there's a legal reason or that there's a legal standing in which we have to send that data. We're doing everything that we can to keep it secure. I will say there is many interfaces, there's many ways in which we communicate with the federal government. And if the federal government overcomes this court case, there will be a situation where DHS will likely have to turn that data over. We are doing everything that we can to make sure that there's legal standing, but ultimately the department, since we are recipients of these federal funds and we are the ones by federal statute mandated to run these programs, there could be an instance if the federal case fails that the data would end up being turned over. We're in communication with states that have turned over data, and it looks very different by every state. So we're interested into seeing what that would look like. But our goal is to preserve and stay as safe as possible, not just for the department, but for the Rhode Islanders that we serve. The answer is we're doing everything that we can, but there is still a risk that if the federal government wins that lawsuit or the next injunction goes their way, that we may have to turn over data. But we are still in that lawsuit with 12, I think it's 12 states in total. It's California et al. Versus USDA. If you're one of those people that likes to go look at that, and that has proceedings in action right now over in the California circuits.
Thanks, Kim. The next question is a little bit broader than like the immigrant related questions we've been doing, but I think it definitely directly impacts folks who are still eligible for SNAP. So it's about the ABOD exemptions in Rhode Island. So ABOD standing for able-bodied adults without dependents. The context here being that this is something that has changed due to the federal reconciliation, OBBBA, with new categories of people now having to meet work requirements. And so can you talk a little bit about how those federal changes will impact SNAP benefits?
Yeah. So the federal government is not aligning medical and SNAP. So I need to say that right away because you're going to hear about work requirements in the medical world, Medicaid world, and you're going to hear about work requirements in SNAP. So Medicaid is going to have some work requirements that are very much like what DHS had for SNAP previously, only now they've restricted SNAP even more. So you're going to hear about work requirements and they're going to be a little bit different for medical and a little bit different for SNAP. I think there's intentionality about making this very complicated for people, but that's just where we are. So for Rhode Islanders right now, able-bodied adults without dependents right now are those 18 to 54 that do not have a dependent in the household and are not disabled, and they have work requirements where they have to participate in 80 hours of work activities per month, every month, so that they can maintain their SNAP for 3 months or longer within a 36-month cycle. This is complicated on purpose, right? They're trying to make these programs complicated so people don't know who's eligible or who's not. So what's going to happen to the SNAP ABOD rules is that the federal government has expanded that up to the age of 64. So it's now 18 to 64. And if your youngest child is over the age of 14, you're also going to be in there. So even though it's able-bodied adults without dependents, it's now actually with some dependents if your dependent is 14, youngest dependent is 14 or older. So they're changing who's in the ABOD pool or who has these work requirements attached to them. It's a bigger pool now. They've also removed some of the exemptions. Right now, you can be exempt from those work requirements if you are homeless, if you have a veterans, any type of veteran status, or in Rhode Island, we call it voluntary extension of care. You're in foster care or you're in DCYF engaged at the age of 18. So the federal government has removed those exemptions. What's really important for you all to know is that right now, we haven't received guidance from FNS, but right now our anticipation is that the community provisions, which means a community provider can look at Kim Roush and be working with Kim Roush, and they can actually fill out a form that says Kim Roush is not work ready. Kim Roush has, some mental health, some physical health, or just some general things happening in her world right now that she is not going to be work required. And that community document is still on our website today. It needs to be adjusted. But what we'll do is that we will be targeting those documents and those community letters out to individuals as this work requirements for SNAP go through. There's also medical exemptions. So if somebody has a medical reason why they're not working or medical demands, a lot of medical appointments, things are coming up, they can fill out a medical form and take that to their doctor, and that can also exempt them. So when we look at work requirements across the SNAP program, more population is going to be in the work requirement area. And then more people are going to be looking for services in order to be compliant with those requirements, and less people are going to be exempt because the federal government has removed those three exemptions: the homeless, the voluntary extension of care, which is our DCYF engaged, and those veteran population. Right now, DHS doesn't have that many people utilizing those exemptions. We only have about 150 to 250 people utilizing those exemptions because we have many cities and towns fully waived from these work requirements. And so the federal government has changed that rule as well. And that will come into effect in 2026, where we have to reevaluate which cities and towns are affected by the ABOD rules and which cities and towns are not affected by the ABOD rules. So we'll have more information to come out in early 2026. But for right now, if you're working with individuals that are SNAP recipients and they fall into the 18 to 64, or their youngest child is 14 or over, you can help them out by filling out that community level form and turn it into DHS. It's very straightforward. It's Kim Roush's information. I work with Kim Roush on a regular basis. She is not work ready. You can give us a couple comments on why she can't be work ready, and that can be submitted into Kim Roush's form so that if and when her time comes up to participate in the ABOD requirements, we can pull that down. We might call you and just make sure that that information is still valid. But that is another exemption. It's a pretty broad exemption that allows individuals to be able to receive SNAP benefits for more than 3 months in a 36-month cycle without having to do volunteer work or actual work to satisfy that 80 hours per month requirement.
Thank you.
You're welcome.
How will these new policies affect the 62 and over population?
So this is a big one where we're waiting for some more guidance from FNS, so we have to make some assumptions here. So right now, if somebody's 60 or over and they have a set income, which means like they could be on a retirement, they could be on SSI. If they have a set income, they're 60 or over, or they're disabled and on a set income, they don't have dependents in the household, there's no work income or earned income coming in, they actually get what we call an ESAP application, an elderly application, elderly and disabled application, and they actually only recertify once every 36 months. So that does not seem to be changing at this time. So the federal government hasn't said the ESAP world has to change. So if somebody falls within that, it should remain the same. It shouldn't be a big change. But if somebody falls within that and is now a work registrant, a work required activity, and they're between the ages of 60 and 64 in that realm, they could now have a work requirement. Now, if they're already volunteering and they're already doing community-based activities that count towards their 80 hours per month, we can take that in. But what's going to be challenging is if that 62-year-old chooses to go back to work, then they're going to go back into a regular cycle for SNAP where that every 6 months they either have to do their interim or recertification. They're no longer going to be eligible for that 36-month cycle because they're no longer just receiving one fixed income. So that's something that we have to have individuals, especially those that are older, weigh the importance of what they're doing in these AWOD rules. It might be better for somebody to do those volunteer hours, go to your local food pantry, go to your local church, go to your library and do your volunteer hours there, because then you get to maintain that 36-month cycle. If somebody does go back into work and they are right now an ESAP individual, they would no longer be an ESAP individual. They don't get that 36-month cycle, and they are going to start doing their recertification at 12 months and their interim at 6 months. So just need people to be aware as you comply with the able-bodied adults without dependence rules, those work requirement rules, it could affect your eligibility, either on income coming into your case. You have income now, your SNAP's going to go down, or it could change how often you have to give paperwork and recertify with DHS. So with our older population, we're going to be working with our Office of Healthy Aging and some other groups to make sure that we get this information out into the community. But it's really important to acknowledge that with these new work requirements, some folks may have different recertification rules now.
Thank you. And this question has been coming up in the chat as well. Will DHS programs be asking for social security numbers for clients? And I think with the framing that like people are concerned about like the data privacy issue, and potentially any recommendations you might have around that as of right now.
Yeah, so it is federally mandated that we receive and request Social Security numbers. So that is something that we cannot, all of our determinations of our benefits for our federal-based programs mandate that we request, and if they have a Social Security number, we utilize that. Many of our programs have federal mandates that we bounce a Social Security number up off a federal hub. So when we have a program like SNAP, when we have a program like medical, even on our TANF and our childcare programs, those Social Security numbers are mandatory items within our system. They're mandatory in order for us to have correct eligibility determination. And programs like SNAP specifically utilize Social Security numbers to make sure that folks are only receiving SNAP in one state, and that's a federal mandate there. So what's challenging here is that as we talk about Social Security numbers, there's many cases that don't have Social Security numbers, and that falls usually within two buckets. One is a child under the age of 1. They are new to this world, new to this family. They have not yet been given a Social Security number. So a lot of the time, we'll get asked, how many people do you have on your, on your rolls or in your system that don't have Social Security numbers? It's a lot, but almost all of them are under the age of 1. So it's not necessarily just an immigration question when we talk about what's the immigration status or what's somebody's status when you talk about a Social Security number. But for the majority of our federal programs, we do mandate the Social Security number because it is a federally mandated data element. It's something that we have to bounce up against in our Medicaid world and in our SNAP world. It's in. For those that don't have a Social Security number, either their immigration status has not taken them to a spot where they're eligible for a Social Security number yet, but they are right now in an eligible status. We can get the numbers off of their USCIS documentation. We can use other self-identifying numbers. We can even provide a fake Social Security number for a baby or somebody that has legal status but has not yet been given a Social Security number just to cover it within our system. But typically when we talk about the safety of a Social Security number, it more is the concern with, are we sharing those with the federal government? And for the most part, how we share our data with the federal government for most of our work is that aggregate that I explained before. How many humanitarian parolees do you have? We have 5,000. Very rarely do we send the federal government huge data sets of information, including Social Security numbers. A lot of the time they ask for a unique identifier, right? And so our system has a unique identifier for every person that is not their social security number, because that is a better and more safe way to treat that data. We try not to play in the world of social security numbers unless we absolutely have to. When it comes to providing DHS a social security number, it is something held in our system. It is something that if the federal government mandates that we provide it, we do. And it is something that goes into an interface that checks up against whether or not that person is eligible for certain services. And those are the processes that are very standard to how DHS works normally. It can feel overwhelming and it can feel scary, but right now that is the normal and standard for DHS.
Thank you. Are there any trainings for DHS staff when it comes to dealing with immigrants?
Yeah, so there are quite a few trainings that we have and we work through with staff. And just kind of how I've done it here, it can often be program specific. So we can be very much in a SNAP household, in a SNAP world, and we're talking about what the SNAP requirements are. And then we have a different conversation when we're in the Rhode Island work, so the childcare world, because they're under pre-WOA law as opposed to this. What we often find ourselves doing with our field staff and talking about the immigration is we're talking about what is acceptable for us to take and what is not acceptable for us to take. And as I said before, this rule in the Reconciliation Act is changing what is kind of acceptable, because a lot of the time we could take a work registrant card or we could take some basic information that came in from that individual. And if they had a TPS, if it said humanitarian parole leave, for the most part, we could just accept that and move forward. Now, with this new rules coming in from the Reconciliation Act, we have to really kind of dig in and do one of two things. We have to ask for that USCIS documentation, and this is what we're working on with staff right now, so they understand that. We can't just accept some of that same material we've been accepting. Or we can run it up against one of our federal hubs called SAVE. And so what happens is we can run Kim Rausch's information up against the SAVE network. On the first, it will just say TPS, right? They have a temporary protected status, because that was something that we were able to utilize in prior years. Now, when we run that up against, we have to do what's called a SAVE level 2. And so we run it up against the secondary source in the federal government and try to pull down more information. If Kim Rausch is a TPS, what type of TPS? Oh, she's a humanitarian parolee from Cuba. Okay, that person's going to remain eligible. But that system isn't perfect, and we don't always get accurate information from there, which is often why DHS workers will ask for more documentation from our customers. Specifically, they're going to start asking for USCIS documents. If the customer comes in and we say, where did you declare yourself? Because somebody might have come in Florida, but they didn't declare themselves until they were in Rhode Island. And then we're going to ask for the USCIS documentation from when they declared themselves in Rhode Island. That's what we're actually going to start looking for. So as we go through the trainings with our staff, we have rigorous trainings for all of our programs that touch on immigration. They're all being updated right now because of the Reconciliation Act. Without clear guidance from FNS, we're giving them kind of how I'm walking it through with you right now. The best thing to do is ask for that secondary piece of information, that USCIS document, so that we can really drill in to see what status that individual has to make a correct eligibility determination. If we see from that information that they're not going to be eligible for services, we inform them, and then we inform them of what the process would be. So if it's a single adult, you're not eligible for these programs, we can either voluntary withdrawal or we can go through and put you in as a denial. If there are, let's say, legal permanent resident children in that household where they could receive benefits for the children, we try to explain to them what that process is. It's up to that individual to say, yes, I want to go through a determination for myself or my children and potentially get the benefits, or I'm not comfortable doing this. I would like to withdraw my application. And we try to do that as clearly as possible.
Thank you. I want to compliment that the Immigrant Coalition has a number of materials available in our website. That's immigrantcoalitionri.org. And one of them is Know Your Rights. We have some information about Know Your Rights, what to do if you encounter an assailant, if they come to your house, those materials are available in our website. We also offer information for family preparedness plans. Family preparedness are very important right now because the family preparedness plan involves a document in which you give temporary custody, and I want to stress temporary, for a person that you choose in case you are detained and the person you're not available to take care of your children, who's gonna take care of them? And this information is available in our website. For organizations looking to offer community members this information or training, we offer those trainings as well, both for Know Your Rights and Family Preparedness. And the only thing that you need to do as an organization is contact me at immigrantcoalitionri@gmail.com. The process does take some time because of availability of lawyers, because of capacity. Once you ask me, I'll send you a form and we start a process in which we ask you to give us a date at least a month in advance. And we are also offering with an organization that has the capacity and has some people that need some legal consultations. We offer a one-time event where we bring in lawyers and they can offer legal consultations for free. But then again, these also take a time, at least a month, to be able to coordinate and set up the lawyers. So please contact me for that information at immigrantcoalitionri@gmail.com. And I want to move into our next question. How can we work closer together, especially with frontline workers?
Yeah, so when I'm in front of the frontline staff or when I'm in front of DHS eligibility workers in particular, they're typically begging me for additional information on immigration because it feels like, especially when you're dealing with different individuals, different statuses, sometimes where they entered, how they entered, if they're fleeing domestic violence, if they were victims of human trafficking. There's so many different federal rules or nuances to the federal rules that are not always clear. And then a huge part of this too is making sure that we have, an understanding of what the immigration rule is at that moment. And sometimes during certain political situations, and we're kind of in one of those right now, it feels like it's changing a lot. It doesn't feel like it's the same eligibility regularly. If there are materials that I can send my frontline workers, if there are trainings or events that you all are hosting in the community, I can always make sure that the community, that the workforce is aware of what's there. I oftentimes share great resources with them. So as I'm hearing Juan Pablo speak about the different opportunities available, through the coalition, that's something that I flag for my own workers. Please make sure that you're aware of this. If there are trainings that happen, we oftentimes run at minimum one time per year, like a very more robust immigration training. And we get into the ins and outs of the different refugees, asylees, the locations of those refugees and asylees, the humanitarian parolees and their origin locations, and what this has looked like, not just in this moment, but why you see eligibility for somebody back from 2021, and then they may not have eligibility today. What changed? What's the difference there? And we try to partner with either immigration attorneys or different agencies across the state that can provide resources and answer real life conversations and real life questions. Somebody came in and they had this status, and then the next time we met with them, they had this status. I didn't think you could change from this status to this status. How did that happen? How do I do this thing? Oftentimes it's in the system, right? Because in our eligibility system, there's 3 different screens that deal with our immigration protocols. So sometimes the question is very internal to DHS. How do I get this person? How do I get somebody that's a humanitarian parolee from Afghanistan into the system because they're now here because their family is here? And that was for a very long time a reason that they could still receive benefits because they were joining a family that came here when that window was open. How do I get that individual in so it counts them? Is that supposed to still be counting them? And we can get into those really specifics. So in the past, we've partnered with Dorcas International. Our refugee coordinator, who I believe was on earlier today, Baha Sadur, will oftentimes also do like kind of open office hours to talk about our refugee populations and what they can and they cannot access while they're here, while families are receiving the Rhode Island Works program, but individuals and couples without children are receiving refugee cash assistance. What are they eligible for during that time period? The other piece of this that's a little bit complicated is that our federal government will often say, well, no, it's up to you, the state, to make a determination, but we're using the federal rules to make that determination. But no matter what we ask of the federal government, it's, well, the state can make the determination. The reason they say that is because they don't know if we run a state level program. And so a lot of the time, even though the federal rules don't allow for it, they'll still come back and tell us, well, the state can make a determination. Here's the guidance that you're looking for from this federal input. So we try to convey that to the field staff as clearly as possible. But I encourage you highly, if you have sessions, if you have information that you would like us to share with our field staff, we're happy to do that. Many of our field staff like to get involved in their local communities. So if you have activities or you have events that are happening, I share that with the DHS population because we want to be engaging with our community. We might have loved ones that are also affected by these rules, and we want to share those resources as well. So please send those my way. I'm happy to integrate those resources with customers as well as with DHS staff.
Thank you. Okay, and now this is going to be kind of the last question, and it's general for the audience as well. So I'm about to unspotlight everyone here so we can all be on equal footing. And then we will just have like a broad discussion. I will request that people either use the raise hands feature, so not everyone's talking at once, or use the chat. We have collected some of the comments from the chat, so I'll be prioritizing that first. But the question is, how are organizations meeting the basic needs of households that have either already lost income due to federal immigration policies or actions, or, you know, there's a lot of fears. People are already just like not using their benefits and have lost income in that way. So this is like for anyone here. Please comment in the chat or, you know, just use the raise hands feature and unmute. Okay. There was a question in the chat that's kind of related to this around what is the state doing in terms of additional funding to help meet work requirements, and is there a timeline for a client to meet them? So we can go on to that. But if anyone is just thinking and needs some time, feel free to chime in at a later.
Yeah, so we are hosting a few events or co-hosting some events with United Way about understanding what the resources are for certain populations, especially our refugee populations, and making sure that we understand what is available in the safety net of Rhode Island, not just necessarily under the safety net of DHS. So if you're not connected with Baha from my team, or Fred Sneesby, who's worked in this area for a long time, we encourage you to touch base with some of the DHS folks that have been in this space, not only just the refugee space, but really the space of sometimes we say, you know, newcomers, individuals that have come to Rhode Island. They have mixed status. They might not have status at all. They're looking for services. They don't know what they are not eligible for. We try to do some mapping every few years to understand what is available to those populations. There's programs like WIC that don't ask questions right now about immigration status now. I don't know if things have changed for them. I did touch base with our WIC group, and you know they're worried about their funding, but right now that they seem to be fully funded, and they're looking to make sure that you know communities are aware of the different services available. So when I think about DHS, safety net, if this is a population that is losing services, the community-based providers are working, you know, with DHS, with United Way to really understand what is available out there and making sure that the community-based partners that are doing this work have some resources wrapped around them. Now, with regards to funding, And also in the reconciliation bill is a cut of about $13 million in funding to the SNAP program. So the funding that DHS uses to manage this program is basically getting cut in half. So with that being said, we are determined to do everything that we can to maintain as many services as possible for Rhode Islanders across the state. We have to get creative on how to find services and wrap around what's necessary for our customers out in the community. And so what I mean by that is when individuals, for example, our ABOD requirements, our work requirements are going to be going to the community, they might need resources for more education, more training in order to walk into a position or a job so that they can be successful. So we're talking to, Rhode Island Commerce, and we're talking to different agencies on ways that we can show better, tactics, better ways for employers to work with individuals that might not be originally from the United States. How can you do this? And also, why is this better for your company? Why is this better for your agency to work with individuals that have lived experience and have done different things, that have lived outside the United States? So we've been started to knock on doors and start having those conversations right now. But as for timeline, we're not 100% sure. We are thinking some of the work requirements could be enacted as early as November 1st, but individuals that are brand new to these work requirements will receive 3 months of benefits before the work requirements would stop their SNAP. So they would receive November, December, and January before their benefits would stop. We don't want to wait that period of time. We don't want to wait for benefits to stop to engage with those customers. So we're going to be communicating with them. We're going to be trying to use email, text message, as well as snail mail or old-fashioned USPS mail to get information out to people that they're participating in volunteering or work requirements that DHS isn't aware of. Get that information to DHS. And that if they don't feel as though that they can comply with the work requirements, do they fit within the existing exemptions that are there? Let's get that paperwork and let's start talking about that. When it comes to funding, we are limited on what we can put out there, but we want to target and make sure that individuals, A, are aware of what these new requirements are, and B, if they need assistance in working through these requirements, we try to fund agencies across the state with at least the information, getting that information out there, and if dollars allow, running some additional training program and running some additional education programs so that folks can receive the services that they need to comply with these. I'm not going to lie and say that that pool is never ending. It is a finite pool of funding. And we want to know from the community partners, where would it best be spent? So we're having some of those conversations as well. We don't want to duplicate efforts and utilize funding in a place that's not useful. We want to expand efforts and expand where the community sees the most value. And so in conversations amongst our, CAP networks, in conversations amongst different networks, we're trying to see where the funding is best utilized. And United Way in some of this world is trying to pull some meetings together for us to help have community input from that. And as well as the federal compliance meeting that OHHS is putting on, we've tapped into about 130 or so community-based organizations that we're trying to get feedback in through those meetings as well.
Thank you, Kim. I think one question that folks had, this is an interesting one around like work requirements for people who are still qualified, but like they need an employment authorization document. I think this was specific around Cuban and Haitian entrants. But we've been hearing that like EADs are now getting revoked, or it's getting harder to access them. So like, how is it going to be possible for these folks to be able to continue accessing these benefits or completing the new requirements? And is the state planning on doing anything around that issue?
Yeah, so the work requirements also allow for employment and training. So if they're in a job skill seminar, if they're in English as a second language class, if they're in things like that, that can count towards their mandatory hours every single month. So we try to read these options as broadly as possible. So if somebody is not work eligible at this time, and this happens, the federal government mandates that they have a work requirement, but they have not actually hit the time within their status that they have a work registrant or work paperwork. So what we try to do in those instances, we try to get them hooked up and engaged with any employment and training providers, any including online employment and training providers or employment and training activities that can be recorded from online. Even LinkedIn and other options have free employment and training options. We'll count anything that they can provide us. Volunteer options. Let's say their employment and training comes up to about 25 hours per week. If they're volunteering at their local church for 3 hours every Sunday, that could be an extra 12 to 15 hours as well that we can add to their other hours. What's tricky here is that they need to give us, a letter stating I am doing these work requirements online. I'm participating in some free activities. There's many universities that actually have free online courses these days. They can take those online courses and print out, that they're doing that from a local library. They can go into the library if the library has open hours on like how to learn internet and do things like that. And they can print down those materials and give them to DHS. And in combination with, proof of volunteering, if they're volunteering at their local church, they can get something that says, yes, Kim Rausch has been volunteering here. She's here every Sunday, from 3 to 4 hours per week. And we can sign off on that. Another weird thing about work requirements, and this is hard to explain sometimes, is that the federal government right now, they haven't changed it, says that you have to work 80 hours per week according to federal minimum wage. So Rhode Island has nearly double federal minimum wage. So if somebody is working part-time, if they're working 40 hours per month, actually it's less than 40 hours per month, they're very likely satisfying all of their work requirements for SNAP and potentially for their Medicaid program as well. Because that rule is still the old rule. And again, we're waiting for federal guidance here, but we haven't seen anything in the Reconciliation Act that tells us differently. So if somebody's only working 3 to 5 hours per week, or they're working per diem, they only pick up one shift per week, that actually might be enough to satisfy their work requirements. It's 80 hours per month of work at federal minimum wage. So when you take it to Rhode Island minimum wage, it turns out to only be 40 hours-ish. It's like 38 something hours per month in order to satisfy the rules. And you break that down, it's less than 10 hours per week. So somebody that's working per diem or working here and there, it's a lower threshold. Volunteer hours is still 80 hours per week. I mean, sorry, 80 hours per month. So there's things here to take into consideration. Taking care of, young children, taking care of, the elderly, taking care of different individuals throughout their community can count towards their volunteer hours. So there are things like that that we want to make sure that people are aware of, and that's the information that we're giving out. If somebody is not a work registrant yet, they do not have their work papers, and we're hearing this a lot across the state, there's misinformation. Somebody has a work visa, but for whatever reason, their employer is too nervous to maintain their employment or saying, I'm not giving them hours anymore. We can work with, our resources. We've talked about trying to give a generic letter, from the state that says something along the lines that, this person's required to actually work. We'd really like you to continue working with them. We'd really like you to participate with them. However, that doesn't always necessarily maintain equaling somebody being able to keep that employment or keep that position. And there's a lot of fear out there about even talking about a status with an employer. So we don't want to put anybody at risk. We don't want to put anybody in a situation that could make them lose their current hours. We're trying to work within the community so that the information comes out without DHS necessarily having to show up and say, hey, I need work information from this individual. And a lot of the time, many people will just say, I need this for my health insurance. I get health insurance this way, as opposed to saying, I get my SNAP this way, or I get cash benefits this way. Many people will rather say, hey, I get my health insurance this way. Can I make sure I have this information so I can keep my health insurance? And if you give it for health insurance, we can take it for SNAP and other programs. So that's absolutely okay to say to an employer as well.
You. So we had a few questions around domestic violence survivors. I lost that. Sorry. Okay. So one is around last I knew domestic violence victims and those that had a specific DV victim asylum type status were losing benefits under the OBBBA. Is this accurate? And then another one that was around like any limitations for DV victims, survivors. Is it more based off of where they come from? Any updates you have on that?
Yeah, so my expectation here is a little bit outside of the box from everything else I've talked about, which is very much this is what the Reconciliation Act says, this is what we're interpreting it as. The law that speaks to those survivors of human trafficking and those survivors of domestic violence and other items is in multiple places in federal law. I am hopeful, and this is just a statement, I am very hopeful that as we get information from the federal government about the immigration status, the Reconciliation Act was only touching certain pieces of federal law. It didn't go into every act to change these rules. So what I'm trying to get at is it is very possible that when we receive this information, either from CMS, which is our Medicaid oversight, or FNS USDA, which is our SNAP oversight, if they do say this population is not eligible underneath the Reconciliation Act, I have a feeling that there is going to be court action that is going to lead to some ambiguity here, right? We're not going to be 100% sure if and when court action takes place. And what happens a lot of the time is that once court action is in place, the states can kind of maintain what we've been doing, which right now they receive services, they receive benefits, until we have a finite answer from the courts, which right now has been all over the place, up to the Supreme Court, back down to different circuits and et cetera. So I am hopeful because my knowledge of the human trafficking and the DV survivor and the rights to services is in multiple federal statutes. And my read personally on the Reconciliation Act is it only addressed it in a singular federal statute, that we might have conflicting statutes. I'm not 100% sure on this. I'm still waiting for some guidance from the federal government and guidance from legal partnerships. But I'm under an assumption that if and when the federal guidance comes down that says these folks are not eligible, that there may be court action that could stay or hold off the action on those cases. Because the way I read it, and this is kind of taking off my DHS hat, but the way that I'm looking at those rules and those laws is that I'm seeing their protections for those populations in multiple statutes. And the Reconciliation Act only seems to be speaking to one. And when you have a differentiation of law like that, it typically will go to the courts to get clarification in order to have a decision on who's eligible or not. So that's how I'm reading it. Unfortunately, the federal government is taking a long time to get us the guidance. So until the guidance is here, those court actions don't typically take place. So we're kind of in this limbo land right now. If I read the Reconciliation Act strictly, they would lose their services, they would lose their benefits. I'm under the impression, and I've talked to other states, that because this is in multiple federal statutes, that it likely will be held up in the courts at some point. But if no one files suit, then we have to follow what's in the Reconciliation Act. If suits are filed against that action, then we can stay and we can hold off on implementing those requirements. So that's a little bit more ambiguous than anything else I've spoken to, just because some of us put our legal hats on and are reading through these rules. We have our own questions, which we've escalated and don't have decisions yet.
Thank you. And I think this is going to be the last question before we kind of close out. I do not know how to say this. Etarian, if you don't mind unmuting, just introducing who you are and then your question. Thank you.
Yes, hi. Elizabeth Terrian. I'm the Medicaid specialist at Rhode Island Hospital. And I just have a general question regarding emergency Medicaid for the undocumented. Will that program remain in effect as is? Or will there be changes such as will they be required to fill the work requirements?
So there's a lot of conversation back and forth about what is going to happen in the Medicaid world for emergency actions. These are our EMERS cases. So what we're doing right now is we're going through those federal rules and looking at who is going to be eligible on its face. And again, there's a legal department that is still reviewing this. So all I can say is on its face, it looks like from the Reconciliation Act that if you are not in one of the protected statuses, one of the qualified immigration statuses that allow you to maintain Medicaid, that you would not be eligible anymore for emergency services. However, the state of Rhode Island still has our all kids covered. So our children and our pregnant individuals are covered under that state program. Our federal program is, it looks like on its face that eligibility would not be there. However, this is one area that I know the legal and the policy folks, especially at the Office of Health and Human Services, are doing some additional digging. We have many, many questions out to our federal partners, both at FNS and at CMS, specific to this population and saying, what happens here? There is an emergency situation. How do we move forward with this? And we do not have clarification yet. I am very hopeful that they will carve out or they will be an emergency, a clarification for emergency services underneath this. But right now, without federal guidance on its face, if they don't fall within the eligible Medicaid criteria, it doesn't look like they would be eligible. I'm saying that with a ton of caveats next to it. I'm very hopeful that we get clarification that that is not true. But without further information from CMS, the all kids covered state law is still enacted. That still stays, unless there's a change to state law. And until we get clarification from CMS, I feel like my answer is we're not sure yet. So I don't want to cause alarm, and the Medicaid enactment dates are very different than the SNAP enactment dates. The Medicaid enactment dates are down the line. They're not as immediate as a SNAP. So right now, the world has not changed for the Medicaid world. You're not taking action yet. If somebody comes in today, it's underneath our current rules and law, is my understanding. If and when the enactment dates come, we should have guidance from the federal government. And this is one of the questions that I know we've asked, in my opinion, like 3 different ways to try to see if we can get clarification from our federal partners. So even though I'm saying on its face that they don't appear to be eligible, we have a lot of work to do before that gets enacted and before that decision ultimately gets told to the providers. Is that fair?
Thank you. Yeah.
Let me give first a big shout out to Kim. It's not easy to be on the hot seat for an hour and a half, but you do it very well. And then I'm going to now introduce our executive director of the Economic Progress Institute, Wayona Nelson Davies, to close us out.
Thank you, Divya, and I hope people can hear me. I've been having problems with my sound. But yeah, shout out to Kim, you all. I think we should all thank Kim so much for always showing up, always giving us as much clarity as she has herself in the midst of all of these uncertainties. So we really appreciate you, Kim, for being a partner in this with us, for knowing we can turn to our state agency for transparency and just to go through the process with us. So I appreciate you. I appreciate your entire team for all the work you do. Shout out to Divya for organizing this training and the Immigrant Coalition. One of the things that's really important to all of us, I know it's overwhelming. All of this information is so overwhelming, especially because it's still unclear what is going to ultimately happen. And so I appreciate the opportunity to share information with each other. I think that's where we have to start. Even though it's hard to take in, it's hard to understand, showing up and making sure we're keeping on tab of what's going on and how to help our communities is really, really important. From the EPI perspective, we are committed to giving you information as we know it, because we think that's where our power lies. We're also committed to advocating, because a part of this is Rhode Island has to make some choices. The federal government have made choices to not protect our immigrant communities. We have to make different choices in the state of Rhode Island to protect our immigrant communities. And so EPI is committed to advocate for that type of investment, because we have some choices here, despite how dire it seems. And so we need to look into what those choices are, what those options are, and what can we do to protect our immigrant community. So I think that's one thing I'm leaving here. I think we all have to play a role as well, to think of how we can join in this fight, how we can be creative with what comes. So access to benefits is at risk, and there's no going back from that. But besides state investments, what can we do? We need philanthropy to step up. We need churches to step up. We need all of us to remember our shared humanity in this, you know. So I don't have all the answers, but we're humans, and we're talking about the most vulnerable of Rhode Islanders, and how can each of us show up a little more kinder, show up a little bit more generous, think of ways that community can come together and wrap our hands around immigrants that may not have access to public benefits going forward while we continue to push. I also want us to remember that there have been protections in place, and even though those protections are removed, as long as we have a democracy, those protections can get back into place. So we have to keep hoping that this is not a permanent situation. We have to keep fighting for what we believe our democracy is. We are here to protect immigrants. We are a nation of immigrants. And so these attacks are something I hope we can all get together and recognize that it is not right. And we will do our part to protect our neighbors, and we will do our part to continue to advocate that these protections are put back in place. So I encourage all of us to work together, to be kinder, to know people are going through a lot. There are a lot of uncertainties, but I'm hopeful because over 200 people register for this, so I'm hopeful. Over 130 people show up. And so that gives me hope that Rhode Islanders are paying attention, and Rhode Islanders are willing to work and do what must be done to protect each and every one of us. So thank you for showing up. And thank you for sharing information. And thank you for thinking of creative ways to do what must be done to make sure all Rhode Islanders have access to benefits and access to opportunities that can provide for themselves and their families. Thank you all for being here today. I also want to share that this is not the end of it for us at EPI, and I'm sure definitely not the end of it for those at the Department of Human Services and the Immigrant Coalition. Next up for us at EPI, we will be hosting a Navigating Public Benefits training in November. So please stay tuned for that. We haven't had a date yet. It will be in person to again look at this HR1 bill and see how it's impacting our public benefits programs for everyone. We are also going to follow up this training with a brief on immigrant access to benefit. That will be a tool. By November, we might get more clarity than we currently have. And so we're hoping that policy brief and corresponding documents can help people have at your tips what you need to understand helping people apply for benefits or navigate the new normal we have. And I think that's it. And there will be a survey we'll be sharing out. Please respond to the survey. I know people don't after, but it will help us to make sure these trainings are responding to the needs of our community. And I think that's all the announcements I have to make. Right, Divya? All right. So thank you all again for showing up. And remember our shared humanity. Be kind, and we are all in this together. Appreciate you.